First of all, when it comes to patient trust, what is the first one that you all see there? Creating a caring environment. What does that look like for you? Just yell it out, and I'll repeat it because for the people that are watching virtually. I've gotten good at this. Attention. Creating a caring environment requires attention. Listening, yes. Listening. And there are levels to listening. And sometimes that's very difficult because you're trying to type, you're trying to make sure your documentation is correct, and you're on a time crunch. And you're trying to get so much done in a certain period of time. And we also recognize that we have some patients that love to share, right? And you're like, how do I give the attention? And how do I listen and have that connection at the same time? I'm going to give you a very quick tip. All you have to do is tell them how much time you have. If you will communicate that, you do not need anyone to page you overhead to rescue you. You don't need for anyone to come tap on you, to come and get you. You don't need any of that. All you need to do is just say, okay, for a moment, I'm going to document because you know I'm not good at multitasking, and I want to make sure that the information that I enter is accurate, because I want to capture your data correctly, because this is a part of your medical record, which is really important. And then I want to hear from you. Now, I really try to give my patients my undivided attention. So I have a good 3 or 4 minutes to really hear about how you're doing. Now, as we get towards the end of that 3 or 4 minutes, I'm going to wrap that up. And guess what? I do this in regular conversations with people because you probably should practice with them as well. You kind of just say, and towards the end, I was like, okay, you've shared a lot, but is there one thing that you really want me to know today out of all the things you shared? And guess what happens? They'll skip over all the things about the grandkids and all the extra stuff, and they'll get to the point when they realize they only have 1 minute left. Because I say I have about 1 minute left, because I really want to know what's really important to you now that you want me to know before I go to the next patient. Because it's really important that I get this, that I hear from you, that you want me to know what's important to you when it comes to your symptoms, what is important to you when it comes to how was your last treatment, whatever it was, what was important to you that you want me to know. You need to be clear in your question that you ask them, because if you don't, if you leave it too open, you're asking for 30 minutes. So be very clear with your open-ended question and then give them a time frame. Even if it's 3 minutes, you'd be amazed at the quality of information you can get. 3 minutes is really a long time. I usually try to give people 2. But give people like 3 minutes and just let them share, and you can wrap that up. That way you do not have to be afraid to allow people to communicate with you, to create that caring environment. The second one, address their clinical needs. I know that some people call your name a lot, continuously. If you already know who they are, why do you keep waiting for them to call your name? You should just anticipate that they're going to do it. So if you already know that they're going to do it, just go ahead and say, listen, I know that you're getting ready to call my name. I'll be there in just a moment. Guess what that does? That minimizes your frustration of having to keep hearing your name. And then that lets them know, oh, they understand that I want to hear from them. And that brings that frustration down because I'm addressing their clinical needs. Also, demonstrate empathy and cultural competency. If you find that you have a new patient from a different ethnicity, or if you find that you're in a facility that has a population of an ethnicity that is different or from a different culture that's not your own, it's first important that you don't make generalizations. And yes, you can do some research, but you know who are the best people that can share with you about their culture? The patients. You just got to know which questions to ask. They will absolutely love to tell you about their food, about their weekend, about them growing up, about what their life was like, and you get bits and pieces in your 3-minute conversations. You don't try to get it all in 30 minutes or an hour. You get it in your 3-minute conversations to develop your cultural competency. You want to get the basics from your research, and then that gives you your bones. But if you want to add the meat, you get your meat from the patients that you serve. Learn about the communities that you are serving so that you can develop some cultural competency. Because if you don't understand why the patients in your facility may not trust you, then you need to understand the communities that you serve. There may be a reason, there may be a history in that community why they may not trust healthcare. There may have been some things that have occurred why they don't go to that particular doctor. We don't know what happened, but something happened in that community. I can give you a wonderful example. Where I'm from, we had decided, because I'm from a small town, anytime they would say, oh, we're going to refer the patients to this particular vascular surgeon, every black patient in my clinic would say, I'm not going to that surgeon. Let me tell you why. Because something happened several times to certain people within our community. And so it created a stigma about that particular surgeon that caused patients to feel unsafe. And so they decided amongst themselves within the community, they do not trust that particular surgeon. So guess what happened? Anytime we kept making appointments for them to go get the catheter taken out and get the access placed, and the nurses kept ignoring them, that they did not want to go see that particular surgeon, it just never happened. And one day, I finally just had to tell them, let me tell you why you're not going to get the access out of those patients, because they're not going to that surgeon. Until you all start listening to what the patients are saying and listen to what choices they want to make, and you will not be able to overcome that. And we may need to address the trust issues that they have with the surgeon, because it may not even be true. But we need to figure that out in the community, because it's reducing the number of surgeons that we have to choose from in this small community. And we need to address that. And that was something that I took the time to do when I was a social worker in that clinic. I actually sat down with the surgeon and say, let me tell you something. They don't trust you. I just had to tell him. I said, I just want you to know they don't trust you. And we got to work on this, because we only have so many, and we got to work through this, right? Because what's happening is we have an increased catheter rate because of that. You see how all of that can become just from cultural competency when you don't take the next level of building that trust? Does that make sense? You all still listening? Yes. I am so shocked. Promoting patient advocacy. That also just requires that you listen. Of course, I'm a social worker, so I had to put advocacy on there. But believe it or not, I didn't get that from my studies. That came from y'all's. And yes, I'm from South Carolina, so I said y'all. It came from y'all's studies, not mine. Your studies actually shared that you all also advocate for your patients. A lot. I know it. You all learn about patient advocacy. And it's important that you do not forget that you don't get so caught up in being a part of the interdisciplinary team that you don't lose within your profession, that you are also a voice for that patient.